The best way to kick off the show is if you can explain what medical trauma and PTS is and how it affects us physically.
Mhm, mhm. Yeah, so medical trauma, it's the psychological and physiological, so our mental and bodily response when we've had any involvement with illness, injury, diagnosis, or any involvement with the healthcare system, where our body feels frightened, it feels like it's been through pain, it's been through overwhelm, if something's felt invasive, or something feels outside of our control. The thing with medical trauma and trauma in general is it doesn't have to look catastrophic from the outside for it to be traumatic. So it's how our nervous system is interpreting it. It's kind of coding it as this is dangerous. This isn't feeling safe to me. So it could be a routine procedure to someone else, but to someone experiencing it, it could feel really unsafe. Medical PTSD, on the other hand, is a diagnosis in the DSM. It has very specific criteria that you need to meet from that. Intrusion symptoms, avoidance symptoms, negative changes in thoughts and mood, and arousal and reactivity. So these are things like your nightmares, flashbacks, avoidance of appointments, avoidance of different things in that. It needs to last longer than a month and have to have a sudden catastrophic event with that. It's kind of when we think of medical things, it can be a little bit controversial because a lot of people, especially when we've been through medical gaslighting and things of that sort, it can be hard because a lot of people who experience medical gaslighting will feel that they experience PTSD, but they will not have experienced what we call a Class A event, which is the sudden and catastrophic part of a PTSD diagnosis. So they would fit into other parts of, there would be other diagnoses that they could fit under, but they wouldn't actually fit under a PTSD diagnosis.